And today we have Dr. Joseph Omofuma, who's going to talk to us about stress and mental health. And I think it's really timely at the moment because of what's going on. We're in lockdown for prolonged periods of time. People are worried about COVID. And so it's really had an impact on even the strongest of us. People who are really upbeat and the half glass full people, it's just had a real impact on us. So I think this is really timely. So what he's going to focus on is stress and how to take care of yourselves, how it can manifest so that you can recognize when you're feeling stressful and what to do. And also the impact it can have on our health as well. So it's there are things we can do to support ourselves. And if you are feeling stressed and it's affecting you, where to go and where to seek help. So over to you, Joseph, and thank you very much for coming this morning.
Thank you, Charles and Ngozi. Apologies for joining a little bit late. Okay, so this morning, we're going to try and look at dealing with mental health and stress. Just going to adjust my lighting here so we can all see me. Right. Okay, so I hope the images are okay. First of all, like Ngozi was saying, this is really important in the climate that we're in at the moment because a lot of people are going through a lot of things. I mean, today I want to try and keep it to a very human level. I don't want to bore you with a lot of medical jargon and things because, we could really go to town on this subject if we wanted to. But I really want to bring it down to the human level because people are going through real stuff. I mean, a lot of people are going through a lot of things. I happen to play a dual role of being a pastor as well as being a medic. And some of the things that we're seeing are truly, very troubling. Just a few weeks ago, I had a gentleman who was only 43 years old. I got called into the situation and he was threatening suicide at the age of 43. And, we had to intervene in the situation. And, this is a very well-read gentleman, very educated, where it's not a case of he's well-to-do. So people are going through a lot of things. People are struggling a lot. Even the strongest of us are struggling under this weight. So let's just jump straight into it. So I want to try and keep it to a conversational level where we really delve into it. But stress can be defined as any type of change that can cause physical, emotional, or psychological strain. Any type of change that causes physical, emotional, or psychological strain. See, it's a body signal to us that something needs to change. It's basically your body telling you that, all is not right and you need to pay attention to it. And shortly we'll be looking at how we can identify it. It can be acute or chronic or episodic. Generally speaking, the longer the stress, the longer we're exposed to this stress, the more likely that we'll have damage for it. So people who've been in been in a situation where they've been in that scenario for a long time, struggle more to come out of that situation. And so it's really important to be able to recognize this and know how to really help ourselves in those situations. I used a big word in terms of, I wanted to talk about psychosomatic disorders because they're really very closely linked to stress. And basically this big word simply means, psycho means mind, somatic means body. So these are disorders which basically that originate from our minds and adversely affect our physical or physiological functioning. So that's one aspect of psychosomatic disorders. Another aspect of psychosomatic disorders are mental factors which cause physical symptoms, but there's no physical disease. And I'll explain that because on the one hand, you have things that are affecting us in our minds, which manifest physically in our bodies. But then there are also things that manifest in our minds, which then show up as symptoms, but there's nothing to find. Okay, I mean, I'll give you loads and loads of different examples as we go along. So just bear that in mind. I have slides that I'm looking at. I would love to be able to share it if I'm able to do that. But what I think is important as well is if you're able to just go along with me and then take some notes. And if you want to ask questions going forward, fortunately, we have a few medics on. I don't have to answer all the questions. Yeah, we have the
I
great
co-host, so you can share.
and a few other people on. Excellent.
Doc, you can share your slide. You can share your screen.
Oh, thank you. Thank you for that. So basically, I wanted to just give you a few definitions and things so that we can all look at it. So any type of changes that causes physical, emotional, or psychological strains. And this is a wide range of things that can do that. Okay, and I mentioned about psychosomatic disorders, which basically two types: physiological stresses, which affect us physically, and then you also have things that are affecting us in our minds, but then there's nothing to find. One very good example is 20% of all chronic pelvic pains have no identifiable cause. Pelvic pains. Some women have pains around the pelvic area, and the gynecologist will investigate from today till thy kingdom come, and they will not find anything. A lot of these symptoms are psychosomatic disorders. Things like rashes, eczema, dermatitis, they come and go. And very often, if you trace the history properly, you'll find out that it's periods of stress that bring on these symptoms and make them more prevalent. Okay, so let's look at what are some of the things that we can sort of identify. Now, like I said, see, stress is a very loose term these days. People use it for all kinds of things. I mean, I have friends who tell me that, you know, when Man United are losing, they're stressed, you know, or if you order carrot cake and somebody brings lemon cake. That's not what I'm talking about today. You know, stress is a real big issue. It's a real medical problem that really, really affects our well-being and can lead to a myriad of you know, medical problems. It leads to all sorts of things. But let's look at how we can identify it. What are the things to look out for in terms of identifying stress? And I've basically tried to, because it's such a huge aspect, I'm going to concentrate on this part more, because for us, we need to be able to look at the telltale signs of things that will help us to be able to, you know, say, you know what, this is what it is. And to be honest, in my life, in my personal working life, I've learned over the years to be able to identify when I'm getting stressed out, and because we all do. One thing I neglected to say at the beginning is stress is not always negative. You see, the stress response is actually sometimes good for us to be able to identify when we need to make a change. So, for example, you see a lion roaming around and it's roaring at you. If the stress response doesn't kick in, you're just going to stand there and it's going to eat you. So stress is good for us to be able to identify something that could be potentially harmful, and then, you know, for us to make that change. The problem arises when we get overwhelmed by, you know, this stress factor, this stressful situation, and then it takes over, and, you know, it now becomes something that is hindering us to the point of causing us to be ill. And that's the kind of stress I really want to focus on. So some of the identifying things that we need to look at is something like this, where people struggle to relax. You know, if you're not able to relax or enjoy pleasurable activities, you know, if you're not able to unwind, as it were, if you're prone to accidents, you're extremely forgetful, you know, poor concentration, those are all telltale signs that you may be stressed. Increased reliance on alcohol, smoking, caffeine, recreational or illegal drugs. You know, when you become a workaholic, when work becomes your go-to, you work so much. It's also some people's escape mechanism. Some people try to escape from reality by just working and working and working and throwing themselves into too much work. Poor time management, poor standards of work. Very often in my line of work, when we have a GP who is not able to manage his time and is not giving a good output, we often draw them aside and find out if they're stressed, because that is one telltale sign that all may not be well. Absenteeism, obviously neglecting your appearance, social withdrawal, things like that. These are things that, especially for those of us who are not healthcare professionals, it's important to identify those things, be it in your spouse, your children, your work colleagues, or people around you. Stress can be very, very subtle. And then everybody has different stress levels. You know, I was listening to a group of doctors. We're talking about teenage mental health. And one guy blurted out, a Caucasian doctor, bless him, he said, what does a 16-year-old have to be stressed about? You know, and this is a popular thought pattern where people think, the child is 14, what do they have things to be stressed about, trust me. The way the world is now, where there's so much pressure, peer pressure, where there's so much social media and things like that. See, the world that some of us grew up in, I'm close to 50, the world that we grew up in, you know, does not exist anymore, because I remember being around when there was no internet, you know, where there were no mobile phones. These guys have so many other things that you know, can distract them and cause them stress. So it's important to recognize when they're stressed and not be a contributive factor, rather be a helpful person in those situations. Another thing that we can look at are emotional signs of stress. So when someone is excessively tearful, irritable, mood swings, they're extra sensitive to criticism. You know, they flare up. You just say one thing and they flare up. Extremely defensive, feeling out of control or lack of motivation, anger, frustrated, lashing out, or a lack of confidence. Those could be emotional signs of stress. Also, psychological signs of stress, I mentioned inability to concentrate. You know, that's quite important. You know, in my previous talks, I talked about things that are medical things that can look like psychiatric problems, if some of you were there. Things like thyroid, lupus, etc. All these things, even menopause, all these things can look like a mental health issue, but they actually have an underlying problem. So that's not what I'm talking about right now. And it's important when we see these kind of symptoms, one of the things we tend to do is to try and exclude those physical health problems before we conclude that it's a mental health issue. And it's really important, because I remember speaking, I like giving you real life examples, because sometimes it helps. I remember seeing a 26-year-old Caucasian young man. He'd been through one GP after the other, and I'm not trying to blow my trumpet or anything, but he'd been through almost 2 years. And I said, you know what, why don't we just do some blood tests? Let's just check you over. And we did some blood tests and found out that, you know, he had low B12, low of this, low of that. And all those things were contributing to his memory problems. So he felt so relieved that I'm not mad after all. And so there are certain things that can mimic or behave like mental health problems. It's just for us to be able to pay attention to those things and to be able to, you know, find somebody who will actually look for them. So some of the other psychological signs are being easily distracted, less intuitive, less creative, excessive worrying, you know, feeling overwhelmed, unmotivated, even depression, anxiety, negative thinking, insomnia, waking up still tired, etc. Now, the one that I'm going to focus on today is the physical signs or physical symptoms of stress. These are the things that can manifest physically in terms of stress. And this list is by no means exhaustive, but you will find that there will be a few things that you may or may not recognize, either in yourself or in the people around you. So things like aches and pains, believe it or not, generalized aches and pains. People come and tell me, I'm just aching for no reason. We do all the tests that, you know, known to man, we don't find anything. You know, we do the blood test, we send them to the specialist, you know, we do the whole hog, and still we don't find anything. Sometimes it's just a physical sign of stress. And that's why I talked about psychosomatic, the mind affecting the body, the mind affecting the body. It's really important that we recognize that we need to, you know, look after our mind. Otherwise, it will begin to affect our body. There's something called bruxism, where people grind their teeth, can be a sign of stress. Frequent colds, frequent infections, when you're always having a runny nose, you know, always having catarrh and this. I'm not talking about people who suffer with allergies or hay fever, but frequent runny nose. Also, flaring up of your allergies. So I mentioned before, eczema is a very good one. Eczema, especially allergic eczema. There are different types of eczema, but allergic eczema, because it's contact dermatitis or contact eczema as well. But allergic eczema in particular, it's been clearly known that if you people who are going through more stressful situations tend to have more flare-ups in those times. Psoriasis, for example, people suffer with a skin condition called psoriasis. The flare-ups tend to be around periods and times of stress. So these are all physical signs of stress. I mean, there are more weight gain, weight loss, indigestion, gastrointestinal problems, ulcers. People that like to keep things in their heart for a long time, people whose personality, you just want to hold on to things, either hurts or abuse and things that have happened in your past. And then it begins to manifest as a physical peptic ulcer, gastric ulcer. It's been known to happen. So it's so important for us to recognize that, because people ask me a question all the time: how did I get this? Where did it all come from? And sometimes you just need to be open and tell them, look, your mindset or your behavior pattern is actually what's causing this. If you're the type that holds a lot of grudges or struggle to forgive, or you've not dealt with issues in your past, it can begin to physically affect you in terms of heartburn, indigestion, ulcers. Talking about palpitations, there are physical signs of anxiety, like palpitations, chest discomfort, shaking, nervousness, panic attacks. I've talked about excessive tiredness. This is a very common one, where there's no reason why you should be tired. I mean, maybe you're 36, 35. This tends to happen more in females for some reason. There's no reason. There's no underlying. We've done the blood test. We've checked everything. We've looked at, and there's no reason, and you're just tired. Sometimes it's psychological stress that's causing you to have that physical symptoms. Then we go on to the big guns. High blood pressure, even a heart attack can be a manifestation of stress. And this is proven fact, especially high blood pressure. I remember when I was in medical school 20, 25, 30 odd years ago, blood pressure used to be known as the silent killer, because you don't show any physical signs. You don't show anything, but in your mind, there's a lot of things going on. And I think in my last discussion here, I gave an example of a 30, I think it was either 37 or 39-year-old Afro-Caribbean chap who ended up having a stroke. And it turned out that he was managing a family business, and they were doing really well. They were doing really, really well. I mean, today he's in Dubai, tomorrow he's in the US and all of that. I said to him as my patient, I said to him, sir, you need to slow down. He was like, oh no, he's this, he's doing that. He said he will slow down when he comes back the next time for his check. The next time I was seeing him for his check, he'd had a stroke, unfortunately, at the age of 39. His blood pressure was 200 over something, over 100 and something. I mean, it was ridiculous readings. But all of that was purely based on the amount of stress and pressure that he was putting himself under. And so, those kind of things, when we talk about prevention, you can see that there are things that you and I can do to mitigate against those things. When you pile on too many things, when you have too many things going on in the fire, too many irons in the fire, multitasking. I mean, some of us are good at multitasking. I have a very active brain. I like to be doing many things at the same time. But when you overdo it, then you expose yourself and start putting yourself under undue pressure. Even performance-related anxiety, when you want to be everything to everybody. You can't be everything to everybody. Poor sleep, if you're not sleeping well. And, sleep is a really strange one. I was speaking to a sleep consultant, and he said some of us, I use us because I can't sleep beyond 5 hours. Some of us function very well on 5 hours of sleep. It's as if we've slept for 8 or 12 hours. They've done this research some time back, and he was telling me, because I went to him and said, is there something wrong with me? Because I can't sleep right from boarding school. I can't sleep beyond 5 hours. And he was like, no, they've done this research. Up to 4 hours is good enough if you get into deep sleep. Baffling to me. They always told us that you needed to sleep 8 hours. But apparently some of us can survive on that, because I'm quite well. But there are some people, if you're meant to be sleeping 7, 8 hours, this is the point I'm making, and you're not getting that rest, you wake up, you're still tired. That's the point where we need to take a step back and begin to check ourselves and find out, hang on a minute, am I doing too much, or am I doing the wrong things here? Is there something that I need to change? Am I overdoing it? Because as we go on, going on quickly in terms of prevention, one of the things that we tend to advise people in terms of prevention is removing yourself from that stressful situation. Just taking yourself out of that stressful situation 9 times out of 10 will help with that stressor. And, let's go back, let's bring it home to the pandemic at the moment. There are things that can literally stress you out. There's a report that came out recently about employers putting pressure on people working from home because they can't see you physically at the computer. They're piling on all kinds of work and asking people to do all sorts of things that under normal circumstances they wouldn't even be doing when they were physically in the office. And so it's important. The first thing that we tend to do as GPs anyway is we begin to look at and identify what are those things that are stressors, what are those potential points and things that you can manipulate and change in order to change your situation. So I said, preventing stress, you need to be able to identify it. Hopefully, if you can, remove yourself from it. Things like abusive relationships, because abusive relationships can pile on stress. If your wife is beat, if you're being beaten by your wife, or you're being beaten by your husband, or the relationship at home is not great, it's really important to be able to remove yourself from that situation. Having a positive outlook towards life. I mentioned this earlier on. If your inclination is to be negative, if your first inclination is to be negative, you are more likely to be stressed. So having a positive outlook towards life is often very helpful. Having a relaxed mental attitude. Now, this I could speak on for the next 1 hour, because this is a whole talk on its own, where we talk about mindfulness and things that can help you relax. I talked about not being able to unwind being part of the issues. And it sounds fluffy to some people, what are you talking about mindfulness? But this is a biggie, because we live in a world now where everything is fast paced. Everything is moving at a gazillion miles, and things are, people are trying to compete with the neighbors. They want to keep up with the Joneses, or you're trying to meet this deadline. You want to do this and that. It's important to be able to take a step back sometimes and just be able to relax. One principle that I tell people, which is simple, but people see it as some kind of eureka moment. Like, you don't have to respond to everything that people say or do around you. You don't have to. You don't have to respond to that email straight away. Being able to put things in positions like knowing what is important, knowing what is urgent, and knowing what can wait. That idea alone is enough to help you stress manage. I remember being at a leadership event organized by the CCG, and they were talking about how this was designed for managers and leaders and things like that, and talking about how to manage stress. And they were teaching us you need to learn how to say no, because every time you say yes to something, you're actually saying no to something else. And if you say no to something, you're probably saying yes to something else. So knowing how to manage those things, it's not, like I said, it's not everything that you have to respond to. Somebody sends an email, or somebody says something, a work colleague is misbehaving. You don't have to respond to those situations. As simple as it sounds, those kind of things often help us to be able to prevent stress. The next one we will probably all be aware of, or probably have heard of at one point in time, having a good work-life balance, being able to know where work ends and when having a life begins. Because sometimes the way some of our jobs are designed, it's as if you're not meant to have a life. I had a GP once who was at my son's birthday, and he brought his computer and everything, and he was typing away and doing stuff at my son's birthday. I was like, dude, it's my son's birthday, but you've brought work here with you. And a lot of us are like that, and we carry work and things. Anyway, I'm not going to psychoanalyze anybody today. I just wanted to bring out the point that, are sometimes obvious, but we don't pay attention to. Things like desisting from bad social habits. So obviously smoking, illicit drugs, late nights, etc. All those things help to prevent or reduce the type of stress or the amount of stress that we're going under. This one has been shown to be a big problem currently in England, which is having a good social support. Loneliness is a big issue, or separation or isolation. A lot of the problems that we have, especially in the elderly population, is isolation or loneliness. This is a big, big, big one, because what we're finding now is a lot of our patients are having problems, not because they have a medical issue, but because they have social problems. And as GPs, we get involved. Like just yesterday, I was involved in about 3 or 4 of these kind of cases where it's all about social support. Research that was done by, I forget the university now, was saying that one of the greatest or the most important factors in terms of predicting well-being wasn't money, it wasn't a healthy lifestyle, it wasn't, whether you smoked or not, or whether you, inhaled like Bill Clinton. It was having good social support, having people around you that love you, that you love, that you can count on. So that social support is really, really important. And having family or even friends or people around you that you can go to, it's really important. As I begin to round up, again, in terms of management, the preventive measures are some form of management. There are ways in which we can look at how we can mitigate against dealing with stress. But counseling is a good one in terms of getting treatment, counseling, then psychotherapy like CBT, obviously medication is important. But these things are often better prevented than curing. I want to go back again to the main issue, the three aspects or 3 particular illnesses that I feel are very important in the Afro-Caribbean population. One of them is hypertension. A lot of times we don't pay attention enough to hypertension. Hypertension is a killer. Hypertension is very silent because you don't show any symptoms, because you don't have any pains. A lot of people don't pay attention to it. So please go, and I know it's COVID and a lot of GPs are not seeing patients, but invest what we do for some of our patients. We tell them to invest in a blood pressure machine. Check your blood pressure at home at least once a week or thereabout. If you're not already hypertensive, you're hypertensive, you should check at least every other day. Blood pressure is really important. Pay attention to your blood pressure. Cholesterol is another one. Because of the types of food that we eat, we tend to be more prone to having some of these issues. The Afro-Caribbean population, most of our foods are quite fatty, filled with stuff, and paying attention and trying to prevent these things is often better. The other one that tends to baffle a lot of people is gastrointestinal problems like IBS or irritable bowel syndrome, where you have stomach aches, you get bloating, sometimes you have diarrhea, sometimes you have constipation, and you're scratching your head. Sometimes your GP is scratching their heads, wondering what's going on with this person. What's going on with this person? Why are we not able to find a cause for their illness? They've investigated you, you've done all the blood tests, you've done everything, and they can't find anything. So these are common illnesses that are associated with stress. Things like, I mentioned hypertension, respiratory ailments like asthma, rhinitis, irritable bowel syndrome, migraine, and tension headaches, often overlooked, but often associated with stress. This is quite different. This is like what precipitates all these symptoms, that you're having stress, but then it now shows up as having these symptoms. Like I mentioned at the beginning, chronic pelvic pain, 20 to 25% of pelvic pain, undiagnosed, no cause, nothing, no reason. The pain is there. They've done all the tests. The gynecologists have done their thing, and they can't find any problem. Sometimes it's associated with stress. Impotence or frigidity is also another main factor. A lot of people come to us, they're having issues in the bedroom, and really by the time you analyze things, it's down to stress. Dermatitis, eczema, and ulcers I have mentioned. So this is just a synopsis, a quick overview of how stress can affect us and how we can look at things that are affecting our minds and things we can do to prevent those things and mitigate against it. Thank you very much. If you have any questions, I'll be quite happy to answer.
Thank you very much, Joseph, for that. That was a real nice overview of some of the things that you might expect and how you might be able to help yourself. So we've got a couple of questions in the chat. So, and if anybody also wants to ask Dr. Joseph a question directly, please use the hand function. So I'm going to start off with one direct question, which is, what is CBT? You mentioned that in your talk, and someone's asked, what is CBT?
Okay, so there are different, thank you, Ngozi. There are different psychological therapies, what we call talking therapies. CBT stands for cognitive behavioral therapy. cognitive behavior therapy. And the aim, there are different types of talking therapies. You have DBT, CBT, etc. DBT is mainly used for younger people. To break it down, one of the aims of CBT is to help you challenge or re-examine why you are thinking the way you are thinking. Basically helps us to realign our thoughts. It usually goes on for either there's a 6-week course, there's a 10-week one, there's a 14-week one, depending on your specific need. So there are CBT trained therapists. It's a specialist thing. You can either self-refer in most boroughs, like in mine, you self-refer to a place, or you can get referred by your GP for that.
Thank you. I think it's really interesting that you've got this sort of dual role as a pastor and a doctor. How often is it that you feel that people come to you either at church, where you feel that this is now crossed into where your medical field, and vice versa? How do you support this dual role, especially with things like stress that perhaps, as you've explained, don't really need medication? What they need is people to reevaluate their life.
Yeah, thank you, because that's a really good question. It's huge. It's something that I still contend with on a daily basis. So here is the thing. Part of it is understanding, because part of it is having a balance, because there is one tangent of people who believe that everything is caused by the devil. If I have a stomach ache, it's caused by the devil, or the witches in the village, or my ancestors are against me. Especially Black people, we're very good at looking that way at spirituality, and sometimes we tend to blame everything around spirituality. One of the things that my medical training helps me to be able to see is to be able to distinguish when there's an obvious medical issue here or psychological issue here, and very often I then have to gently bring that individual back. Not often, it's not very easy, but I have pastors and leaders, church leaders, imams even, that I've had to deal with, to let them know that this is not a spiritual problem. This has nothing to do with your religion. This is just a situation here where you have piled on too much and things have come to a head. I'll give you an example. I talked about a gentleman who was suicidal just 3 weeks ago. He's a church-going gentleman, loves God and everything, but his problem was nothing spiritual. It was the anniversary of his wife's death. He's unfortunately lost his wife. He was piling on, like I said, he was piling on a lot of things, and I stepped in. I spent 2 hours talking to him, and all I was able to tell him, well, mainly what I was able to tell him to do is, you need to demystify your schedule and get help. See, sometimes, again, some of us we feel too strong to be able to know when to ask for help. I don't know if it's a male thing or an African thing where you don't want to ask for help. So there's nothing wrong in saying that I'm a bit overwhelmed, I need some help. And so, yeah, it's been quite a journey, because in the 25 years of being a medic, this has been a recurrent theme, where, because I've been a Christian for as long as that, but more often than not, I have to be brave enough to tell people that this is not a spiritual thing. This is more of a medical thing, and we need to deal with it that way. And very often they thank me for it later, even though they don't accept at the time when it's happening acutely.
Okay, thank you. The other thing is that these health hours, they're one of the things I feel that people who have dialed in and are listening, it's about empowering us and empowering people to take responsibility for their health and actually know when things have crossed over from being something that can be managed by themselves, or when to go and seek extra help.
Yeah.
So when would you say, what's the signs that everybody sitting here who's been feeling slightly stressed out by the situation we're in and uses that as an excuse, thinks that, well, actually, in actual fact, I need to be seeking extra help now. This is not something I can talk myself out of. Uh-huh. I've listened to what you've said. I've listened to what the doctor has said about stepping down my schedule, taking things a little bit slower. but I'm not sure whether I should be going to see my doctor. And we hear the messages that the NHS is overwhelmed and we should only be accessing if we really feel that it's necessary. So is any message out there for people who are here who are perhaps feeling a bit stressed, but are not sure when they need to cross over to get actual help for themselves?
Okay, well, thank you, Ngozi. I think
3 things that they need to think, this is now a bit more than usual.
Yeah, to keep it simple, when things begin to affect your home life, when people around you begin to notice that all is not well, it's perhaps an indication that you've not been managing things well. When you're not coping well with work, especially if you're making simple mistakes, you're going late to work, you're having a lot of sick days, things like that, or you're flaring up easily, you're shouting at your children for no reason. I also do a lot of youth work, and teenagers tell me, my mom is always angry. What does your mom do? She's a nurse or she's a doctor. It doesn't surprise me, because very likely that lovely parent has just brought home work stress and brought it into their home. So if you begin to react in an abnormal way to people around you, because people around you are often the first to see it, but you can also check yourself when you're making mistakes, when you're getting angry easily for no reason, when things that normally wouldn't irritate you are beginning to aggravate you, or if you find out that despite all your efforts, you've slept, and you're still tired, you need to take a step back and do an assessment and say, you know what, maybe I need to look at this further. Maybe I need to be speaking to someone. Maybe I need to get some help.
Okay. There's another question in the chat about young people and psychosomatic symptoms. Now, anybody on the call who has teenagers will know that they flip from one behavior to the other. And as parents, we're really keen to want to help. And we know about all these extra things and extra stresses that they have. So how can we help, and how can we help our young people to try and combat some of these stresses that they find themselves in?
Wow, that's an excellent question. It's also a very long question to answer. The key
top
bullet
points.
points. Well,
the stressed out parents.
Yeah, I teamed up. I think Charles was aware. I've teamed up with a local charity in South Manchester, here where I live, called Rehoboth for Families. We started out initially reaching out to single moms, and then found out that, well, it wasn't just single moms who needed support. And what we've been doing is having lots of what I call mentoring sessions with these young people. What parents can do, first of all, is to begin to recognize patterns. So I think what I say to parents is, you need to be friends with your children. I mean, it sounds cliche, but you need to understand who your child is and what's going on. A lot of times, and I know you guys are not guilty, but a lot of times African parents are not involved with what's going on with their children. Either we're too busy running around for work or doing this and that. It's important to get involved with that child's life, so that when you see things that are not in the usual pattern going on, you can quickly recognize it. But what I often say as well is, get them to have mentors and role models in their lives. It's so important. It's so important. It's what I call the rule of Harry's dad. You might have been saying things for a long time to your child, and they'll look at you because you're the mom, because you're the dad, But when Harry's dad says it, it suddenly becomes a eureka moment. Harry's dad said, and you're thinking, I've been telling you this for years. But because somebody else said it, it now becomes a revelation. So get them to have role models around them. And no disrespect to footballers and things, but people like Wayne Rooney and Rio Ferdinand should not be mentoring your children. You and I should be our first role models. And depending on where your religious inclination lies, you need to get them godly mentors that will help them. You see, the children are meant to be shaped. It's part of your responsibility as parents, is our responsibility, is to shape them, is to guide them. I listened to a Caucasian mom saying that the 6-year-old boy has rights. I said, yes, they have rights, but then you as parents have responsibilities. And they looked at me like I was saying something strange. It's as if they had abdicated responsibility to this 6-year-old lad to make decisions about his life. And I said, no, you can't do that. It was like a shock. It was like, oh, no one's ever told us. I said, the boy is 6 years old. The reason why God put him in your care as parents, and I know it sounds preachy, but I had to say this to them because they kept on coming back. He's having behavioral issues. The funny thing was, the so-called behavioral issues were not happening in school. They were all happening at home. And that's another thing that we tend to do with child and adolescent mental health. When I'm referring a patient, I give them a form to fill. I also give school a form to fill. If there's a discrepancy between what school is saying and what you are seeing as a parent, then there's a problem at home rather than a generic problem. So there are lots of things and tools that we can access to help teenagers, and it's not one size fits all. It depends on the age of the child, but for teenagers in particular, it's a difficult period for them. They need all the understanding they can get. I mean, one of my colleagues, like I said, what do the teenagers have to be stressed about? They have a lot of things to be stressed about, and what they need sometimes from us who are older is understanding. You need to get into their world. Sometimes you need to step into their shoes for 5 minutes, where you post something on social media and you can get 200 people making a comment. In those, you and I don't have that kind of pressure. Some of us don't even have up to 200 friends on Facebook. But teenagers, it's all over the place. I was eating at a restaurant, and I know I talk a lot, but I was eating at a restaurant and I saw these teenagers. It was just laid in my heart to speak to them. And I started talking to them. I have a heart for young people. There were 6 young ladies. And they were telling me about Snapchat. This was a few years ago. I'd never heard of Snapchat. I didn't even know that there was anything called Snapchat. And I suddenly felt old. But we have to be able to get into the environment where they are and understand where they're coming from. That's basically what I'm saying.
Thank you so much. And I do think our young people have a bit more to deal with at the moment. The fact that they're not with their friends physically, they're at home,
exactly,
schooling from home on in a way that they never envisaged last year. So yes, I think a bit more.
Sorry, Ngozi, there are a few questions here that are directed at me, and it's not in the general chat.
Okay, that's fine.
Someone said, "Is
some of the
high blood
questions
pressure?"
I've had are just to me to tell you as well.
Okay.
I've had some direct messages, the ones I've been asking. But if you've got some direct messages, and anybody who wants to raise their hand and speak directly can do so as well. So you can answer the questions you've been asked directly.
Okay, there's just this one that I thought I shouldn't ignore. Is high blood pressure always caused by stress, or can it be genetic? It can be genetic. Very often, high blood pressure runs in families. But what I often say to people is that the fact that it runs in your family doesn't mean you have to get it. So high blood pressure is caused by, and as well as many other illnesses actually, multifactorial issues. So the environmental factors are there, the psychological factors are there, the genetic factors are there, the dietary factors are there as well. So it's really important that you pay attention to all these things, but yes, it can be genetic. For example, I'll give you an example. In my family, there's diabetes, but I don't have diabetes. So the fact that it runs in your family doesn't mean you have to have it. If you look after yourself and pay attention to all these things, you can escape that. Over to you, Ngozi.
Okay.
Can I ask a question, please?
Yes. I can't see your hand, but you go ahead.
Yes, my name is Paul. I've been introduced to this session since the beginning in January. I've been tuning in every week. I find it very educational, very informative, and you guys are doing a wonderful job, yes? Well, okay. I got a couple of quick questions to ask the doctor and so forth, yeah? In regards, you say you're a medic and also a pastor. What are the medics profession and the pastors are doing in regards to stress and mental health issue in the society these days, especially now that we have the pandemic on top of us all? Now, don't we need to focus on the people in high authorities like the politicians, MPs, all those people who can do something about it? Like 16-year-old is having a heart attack, 16-year-old is having stress and want to commit suicide and all of that. What are the professionals like yourself, sir? What are they doing in targeting the people in authority position to do something about it? And finally, the notes, because I've been listening, but I can't write on this at the same time. Is it possible to get any notes, what you said today on your screen?
Yeah, okay, well, thank you for those questions, Paul. First of all, the last question, yes, I can share my slides to, I can send my slides to on here so that everybody can have access to it, or you can email CAHN info at, somebody help me with that address, and they'll give you the slides. I'll make it available for everybody.
info@CAHN.org.uk.
Thank you. info@CAHN.co.uk. So either that, or it's in the chat, or I can try and share it now before we leave. So that's not a problem. This is really basic information, and I really want everybody to be able to get it if possible. To answer your question, I really love your question because it sits at the heart of everything that I do. I didn't want to go into too much detail when Ngozi asked the question initially in terms of my role as a pastor and as a doctor, but I think here is a good point to do that. So since the pandemic started, there has been, to be fair to the government, because sometimes the government doesn't always get it right, but to be fair to the government, there has been an increase in the amount of grants and bursaries and funds that are made available to, especially to the Afro-Caribbean society community, generally to the community in general. There are things that you can access, so what we have done as a local charity is we've been able to access some of those grants, and we've been able to identify people within the community that require extra help, funding, etc. Before the government gave us any kind of grant, as a church, as a local church, one of the things that we did was we liaised with, I don't know if you know the GMCVO, the Greater Manchester Voluntary Organizations. We were able to feed a lot of single moms, or give grants, monetary grants, to single moms within our local area. So in terms of what we're doing, I know that Ngozi was part of a panel of doctors and professionals who were talking about the COVID vaccine and raising awareness and things like that. As professionals, we're doing everything we can. This is also part of what we're doing, actually, in terms of raising awareness within the community and signposting people to places where they can get help. So be rest assured that we're getting, for me in particular, and for us, for me, since you directed it at me, playing a dual role as a local church charity, we are on the lookout and are trying to identify people who have psychological, financial, physical needs, and being able to help them to access those needs. CAHN, for example, we have a counseling section for people who are going through difficulties, and you can access that freely. You can email that email there, you can speak to Charles or any of the other executives. So there are things in place where you can get help, and it's all very confidential. Nobody else needs to know what's going on with you. The right hand doesn't know what the left hand is doing in this case, because we try and tailor it to your needs in particular. But there's a lot of help out there. That's why I silently mentioned that people need to be more bold about calling out for help. Like I mentioned, we've got these youth mentoring sessions. We've got this financial situations that we're trying to help people with. We've got these mental health things that we're doing to help people. So there's a lot of stuff going out there. Sometimes if we don't know that there's a need, then we can't help people. So if it's you or a relative or somebody that you know, then I would please ask you to encourage them to speak out so that they can get the necessary help that they can get. Is that okay, Paul?
I would just like to add to that. Thank you, Paul, for a really great question, and also for the brilliant feedback, because it's really nice for us to know that people are engaging with our sessions and enjoy our sessions as well. So thank you very much for that. I'm a paediatrician, and as such, I belong to the Royal College of Paediatrics and Child Health, which is the group of paediatricians who not only look at education for paediatricians, but look at the impact of lots of services on the health of our children. And what we've seen during the pandemic is that a number of factors have been seen to contribute to the increased stress in our children. They're isolated from their peers. There are school closures. Most children would see, you'd ask them at the beginning of the year, do you want to do exams? They say no, but in actual fact, it gives them a structure. So cancelling exams with very short notice has had an impact on them as well. The fact that they've been on their devices for much longer and have a altered sense of body image because they've had a lot more time to look at social media has also caused problems. And what we've seen in the reality is that we've seen a lot more children who have been admitted to hospitals for eating disorders. We've had children who have been stressed out because of illness and fear of death of their of their loved ones. So it is a real problem. So the Royal College of Paediatricians have put together some, as well as the fact that when we try and refer children into services, that a lot of the services have been stepped back and stepped down because they weren't seen as acute services. And so people were diverted to work. Many of us doctors have been diverted from our everyday work to working to COVID wards because that's where the need was seen. But we have now started to recognize that this is a real problem and it will become a pandemic in itself. And we cannot stop treating illnesses that are seen as maybe not life-threatening, because in actual fact, they have a severe impact on the health of our young children going forward. So what I was going to ask, Joseph, is the thing you talked about, is that open to everybody? And whether you could put the counseling sessions, the details in the chat, or is that a specific group?
No, so they're open to everybody. So already, thank you, Ngozi, for that brilliant addition as well. So a lot of things have been added onto the chat for everyone to see. Like I said, I wear a lot of hats, but one of my hats is working alongside CAHN as a mental health lead within CAHN. So you've got there's a community response there. There's the counseling and well-being, emotional support there. All the information is there if anybody wants to access it. I've also emailed my presentation today to our moderator. I think it's either Karen or somebody who's doing that, so that they can share it with everybody who's been on the presentation today. So, but also the work that I do within the community from the church is also open to everybody. And I'll ask Charles to share that as well. The next mentoring session that we're going to be doing, I think is either March or April, but the videos for the previous one are available for people to see. We've had a lot of feedback. I think it was just 2 or 3 weeks ago, we had 87 teenagers connecting to that one session. You know, we were expecting 30 to 40 people, 87. So just to go along with what Ngozi was saying, a lot of our children are at home. They're more isolated. They're spending a lot of time on their devices. So they need all the support that they can get. And, you know, it's really up to us to encourage them to access all the different support systems that are available out there.
Okay. There's been a question from Jenny. I've seen it, Jenny. It's just what we started talking about children, but this is an important question as well. So Jenny's asked, what advice and help can you offer or signpost a young male person who's been subject to abuse from their partner? And they've been in a relationship with this person for quite a long time, for 10 years, but finding things really difficult. Is there anything anywhere we can signpost them to? Or specific advice that we can give? Thank you very much for raising that, Jenny, because that's another issue that we've seen during the pandemic. Yeah. Because people have been forced to spend additional time with partners where previously you had an outlet, you could go to the pub, you could go and see friends. The fact that people have been forced to spend time with each other, in some cases it strengthened the relationship, but we know it's been really stressful for other couples.
Yeah, thank you, Ngozi. Well, there are lots of organizations, depending on where you live, that give support to domestic violence and domestic issues. So depending on where you live, there's a charity called Relate that you can contact online. There's Healthy Minds. These are all mental health charities, but they also deal with things along the lines of domestic violence. But what I would say is, if there's a lot of abuse in that relationship, if I was to speak to that young man one-on-one, depending on the scenario, they need to take themselves out of that situation for a brief period of time. That would be my initial advice, because the longer you are in a stressful situation, the less likely you are to recover from it going forward. So if this situation, this is what I say to people, that unfortunately in my life, especially in my pastoral life, we've had to bury 2 or 3 women, especially women, because of domestic abuse. And I wouldn't wish it on anybody, where the domestic abuse had piled on and piled on and piled on, and the woman ended up either being killed or committing suicide. There was also a Caucasian chap who attempted to commit suicide because of psychological abuse from the wife. I mean, 63-year-old man trying to hang himself in front of his children. So what I often say to people, and it doesn't, obviously it's not one rule applies to all, but if the situation is that bad, before you get to the point where you're at crisis point, it may be worth separating yourself from that stressful situation, even if it's for a short period of time, to try and reevaluate. But by all means, encourage this young man to get professional help. There's no two ways about it. They need an external third person to look into the situation objectively and give them advice on where they need to go. Very often, domestic violence goes unnoticed. Domestic violence goes unaddressed because sometimes even the people who are being abused don't even know they're being abused until things get to a head. So really, if you're looking at it from outside, encourage them to try and get some help. I don't know if Ngozi has anything to add to that.
No, I think that's wonderful advice. I think it's just been a really difficult time for lots of people, and just have to acknowledge that there are people out there who I'm really pleased to see that we've put in a number that we can that people can call confidentially, because it has been a problem during the lockdown, an unanticipated problem that when they said we should go home and spend time together, we didn't think that this was one of the things that would the unanticipated fallout. Yeah. So thank you for that. I think it's been a really informative talk for our health hour, and I would like to just summarize and say, please look after yourselves. I'd like to end on a positive note, because even though as families and friends and our loved ones were going through this pandemic, that this health hour has been one of the positive things to come out of that. And the fact that we can come on a Saturday morning, support ourselves, give ourselves advice as well, signpost where to go, I think is something that will continue long after the pandemic. So thank you all for dialing in. Next week, now last week at the end of it,
you've got another question from YouTube in the chat box.
Another question from, can stress in children manifest in similar ways to adults? Are there particular signs to look out for?
Sorry, say that again, I didn't get that.
Can stress in children manifest in similar ways to adults? Are there particular signs to look out for?
Right, so the answer is yes and no. So there are specific things that are peculiar to children. Children tend to manifest in a separate way. There are certain things that will cut across the board, but if you're looking specifically in children, they tend to be more of withdrawal. They tend to go away, they hide away from social events. They tend to be less talkative. It may even present as anorexia, where they're not eating or they're overeating. It may present as poor sleep. It may present as bedwetting. So in children, you can see a myriad of other things that I remember a 9-year-old whose parents had just separated. And after 7 years of being dry, she suddenly started bedwetting. And, my colleagues and I were under pressure, referred to pediatrician. God gave me a wisdom, and I just called the mom aside and said, has anything changed? And she mentioned about the fact that recently separated from the husband, it wasn't an amicable divorce and all of that. She loved her dad, and that was the trigger. So there was nothing physically wrong with that child, but she started bedwetting out of the extenuating circumstance. So the answer is yes, it can present in a different way. There are some certain similarities, but it can definitely present in a different way. I've shared my slide to everybody on here, who, if you care to download it, if you look on the slide, because what I have tried to do is to look at identifying things that present as stress. So in my presentation, I looked at behavioral symptoms. So, being prone to accidents, not being able to relax, absenteeism. When a child isn't going to school, as Ngozi would know very well, I don't know if you're still doing that or if you're just into neonates these days, but if a child is missing school, it's often a cause for concern because that could be a child protection issue. So in terms of children, neglect, the way they show up in school, if they're always unkempt. There was a child who was stealing other children's food, 4-year-old stealing other children's food. And then it turned out that the mom just wasn't feeding this child. It was a case of child neglect. You know, and the mom said, oh, she's just a bad child. You know, she comes, but why would a 4 or 5 year old be stealing other children's food? When we looked into it further, it was a case of child neglect. So yes, it can present in a slightly different way. You just need to know the things to look out for. Someone's asking, can we signpost people to you? Please signpost them to Charles. Charles knows how to deal with them, or to CAHN. And wearing my CAHN hat, we can organize sessions on how we can deal with that. Because as you can well imagine, it's easier to deal with a large group of people rather than for me to deal with individual cases. If there is an emergency situation, the coordinators of CAHN are very good at dealing with that and bringing that to bear. There's a lot of helplines as well for young people, which have been shared on here for us to look at.
Okay, thank you very much, Joseph. So I don't think there are any more questions. So as I was saying, it's been a really informative session for me as well. And last week, I erroneously said that the session for next week was happening this week, if you can understand, if you can follow me. But next week, we do have a session with microbiologists and virologists. And, you know, as much as we've had a lot about discussions about COVID and the vaccine, I think this session is just going to tell us specifically about the vaccine, because I think people still have a number of questions. There have now been 14 million people in the UK who's been vaccinated, but I know there's still quite a number of questions that some people have about the vaccine. I did see some statistics the other day that worried me quite a lot. And one of these was within because they had obviously a tiered system of who was going to get it, and if you were vulnerable based on your age, and also on the job you do. Now, I work in a hospital and they have offered it to all the staff, but it looks as if they've left behind the people that are not getting vaccinated are our bank workers, people who are locums, and very often these are people right on the front line who cannot decide exactly where they work. They turn up on the day and they're told where to go. So this is a real concern of mine, and I've actually discussed in my organisation that we need to make sure that we're collecting the figures and also encouraging people to have the vaccine if they want it. So what we don't want to happen is that people who want the vaccine don't have access to it. Now, there are people who are making a conscious choice not to have it, and as long as you've made that based on the information, no one's going to force you to have it. But as much as possible, what we're trying to do is provide additional information for people who are wanting that information before they make a choice. So next week, anything you want to know about the vaccine per se, there'll be experts here to tell you about that.
Oh my God, you knocked your head.
So, sorry about the interference.
Where are you going now, anyway?
So join us if you can next weekend at the same time, same place, and see you next week. Thank you so much.
Thank you all.
Thank you all.
Thank you very much.
Thank you.
Thank you.
Thanks for joining in. See you all next time.
Thank you. Good session. God bless you.
Bless
Can
you
we,
too.
can we receive those points the doctor gave so that we can go through it again?
Yes, Margaret, they have been put in the chat box, but if you drop us if you put your email address in the chat box, we will send that to you.
You have my email, onche2003@yahoo.com.
Okay, we will send you the slides.
All right, thanks very much.
Okay,
Thank you very much, Ngozi and Chad. Thank you.
okay.
Hello. Hello, Charles, can you hear me?
Yes, I can hear you.
Yeah, Charles, I'm Paul. I'm not too good at these savvy things. If I give you my email or my thing, can you send me so I can write the notes down?
Yes,
I'll
do that.
But send me a text. My phone is 0807 484 608
07
Yeah, 484
07484
608
Charles, are we still live on YouTube? He's giving out his phone number.
All right.
Yeah.
700.